Not every patient requires a total knee replacement surgery, especially in those cases where only one compartment of the knee is involved. Partial knee replacement surgery is a precision surgery when done for the right patient. It is not a smaller version of a total knee replacement surgery. The surgical skills and the surgical techniques which we use are different for both the surgeries. So when we see the patient, we keep the patients in two broad categories. One, where only one part of the knee is involved, that is single compartment arthritis or medial compartment arthritis, which is more common in Indian population. We offer them partial knee replacement surgery. We perform proper x-rays before we go ahead with the discussion of the partial knee replacement surgery. When we start seeing these patients with a mindset of offering a partial knee replacement surgery, then we start identifying more and more such patients who qualify for it. Because doing the right surgery gives good outcome to the patient, not the bigger or a smaller surgery. Second category are the patients who have complete knee arthritis, all three compartments are involved, and we offer them a total knee replacement surgery, and then the discussion goes in direction of robotic or a non-robotic knee replacement surgery. In today's video, I will talk to you about the benefits of a partial knee replacement surgery. Number one, we preserve all the ligaments of the knee. Not even a single ligament is cut. When we do partial knee replacement surgery, we only change one side of the knee with a relatively smaller sized implant. We do not touch the ligaments of the knee which are inside or outside of the knee. We do not touch the outer compartment of the knee and the patellofemoral compartment, which is the joint which the kneecap or patella makes with the thigh bone or femur. So practically only 1/3 of your knee joint is replaced, and you get this surgery done without cutting any ligament. When we do a total knee replacement surgery, there are two techniques. In one technique, only one ligament is cut, which is ACL, and in another technique, both the ligaments are cut, both ACL and PCL. But in every knee replacement surgery, be it partial, be it total, ligaments on the side of the knee joint, the collateral ligaments, must be preserved. Number two, faster recovery. After a surgery which is done using a smaller incision, putting a small implant inside your body without cutting any ligaments makes you recover faster. The knee range of motion is achieved faster. Patients start walking without support much earlier, and they feel the balance of the knee in a much better way. Number three, less requirement of physiotherapy. When you do a total knee replacement surgery, patients require physiotherapy ranging from 3 weeks to 6 weeks, depending upon their muscle strength, their deformity, and other factors in the pre-operative period. While a partial knee replacement patients either do not require physio or they require it for a very short time. Once the patients have understood how the exercises are to be done, they can do it by themselves. Mostly patients do not require physiotherapy beyond 2 weeks. Number four, partial knee replacement surgery is a less painful operation. Although with advent of latest pain management protocols, even total knee replacement surgery is much less painful, especially when it is done robotically. However, partial knee replacement surgery is much less painful. Consider this: if your incision is smaller, if no ligament is cut, if dissection is less, if the implant is small, then of course, you will feel less pain after the surgery and you will recover faster. Number five, patients are able to sit cross-legged and they are able to sit on low stools very comfortably very early in their recovery phase. However, every patient is different, and these range of motions and mobility and flexibility of the joint may vary from patient to patient. And last but not the least, patients with partial knee replacement require a shorter hospital stay. We can send a partial knee replacement patient home the next day of the surgery. But please remember, partial knee replacement surgery is not for everybody. Whosoever is watching this video, and if you have knee arthritis, do not think, okay, let me get a partial knee replacement surgery. I hope this video will give you enough information in simple language about both partial knee replacement and total knee replacement, and specifically about benefits of doing a partial knee replacement surgery. Thank you so much for watching.